Hello friends, today is New Year of India, Makar Sankranti it is called, and I have come up with very good news for all of you. Today morning we also made a video on a Crohn disease, which is also a very incurable disease, and the patient was very much satisfied and happy. And now we have Mr. Ranjit with us, and another very difficult to treat, or I would say rather incurable disease called Hidradenitis Suppurativa. It's a very complicated name. Even the doctors face difficulty in pronouncing it. So it is a kind of pus-filled pockets in the folds of the skin. So we would like to hear from you, Mr. Ranjit. So how you explain us when it was detected and how you suffered from it.
Yeah, first of all, thanks for having me here, sir. It's a real good to share my experience. And in fact, this is what we were discussing, that because the medicine name that you pointed out, Hidradenitis Suppurativa, right?
It's a disease name.
Disease name, yeah. Sorry,
Yes.
the disease name. In fact, that is only you could say that this is the name of the disease.
Yes.
And I'll then come to what actually happened.
Yes.
Means I'll not go in very detail, but just a quick
Yes.
snapshot was last year, and I think early, just in the start of the last year, I got there's a pus-filled, as you said, pus-filled pocket here,
Yes.
and a lot of pus. So I went to big institutes. We can name.
Yes, yes, we can name. There is no problem.
Forties.
The institutes, they will not close down their operations, even if you name them.
Yeah,
You can even name the doctors also who diagnose
no,
you.
no, I won't name the doctors as such.
No, but if somebody diagnose you, yeah, you can see the images.
So these are the images. I don't know if you
Yeah.
might show it later. So
Yeah.
anyway, so they took some samples. They went for testing and lot of tests and culture test, and and finally, means cutting the long story short, it got increased, and then they said you have to take surgery for that.
Okay.
Okay, fine. I didn't saw it that seriously. I thought, okay, my bad. So I went for a surgery, and it took around 3 to 4 months. It was really painful because getting it, operated, and then after the surgery, as you can see here, the entire pus was removed.
This is a very big
Cut,
cut.
big cut, yeah.
Yes.
So this is that.
Yeah.
But I thought that that's the end of the story. But again, after 3 months or maybe a couple of months, I got the same kind of pus. It was not as severe as here, but yeah. So again, I went to the doctor and said, okay, no, this is not that big. So the same procedure. Okay. Again,
They told you that you have to undergo surgery.
no. The second time, I was lucky enough
Okay.
that they extracted.
They drained it.
They drained it off.
Okay.
It was not that severe, but still a small lump was there. And they said, okay, it will go away. Don't have to go for surgery.
Mm.
And I tried to, know what exactly is the reason why it happened or how it, but there was no clarity on that. Okay. Now again, after 3 months, the same symptoms came, it started showing off at my back. You can say the pelvis area. Now this was really I would say alarming, and she was also very was that why this has happened, because third time within the span of 3 to 6 months. And then I said, okay, now we will not go to because I had been to all the 40s max everywhere. So okay, let's go to PGI. Okay, so we went to PGI. As you know, PGI is a very tedious,
very big institute.
big institute.
And complicated.
And we had a tough time, but still, we said no, we are going to diagnose it, deep and try to find a final solution for that. Now, after going one doctor to another to third, then eventually it came up that this is because there was all type of skin doctor involved, and initially we started with normal medicine. Okay, so it was like again getting complicated. So finally, we somebody like the doctor or the coordinator who was there, he said that okay, this is something which is taken care by general medicine, and the head of PJ is now working again in Fortis. So something like that. That okay, why don't you go back there and meet Mr. Okay,
So and
that
so.
was just one. So because he is ex PJ and he has been retired from here. So it was
Senior
something like
doctor.
senior most. Yeah. So it made
Okay.
sense because I was also
Uh-huh.
again I came back and there were around 70 to 80 tests again
So
with that culture.
okay.
And I don't know the test name actually, but I don't remember. Like there means even as I remember in general, like all type of blood tests and all even HIV tests. This time, I mean I don't see there
Everything
was
was done.
anything any
All the
test which
tests were
was
performed. Okay.
So finally it came back that okay, you have to go for surgery again.
Okay.
Okay. And just after 1 month after that, we had our 25th marriage anniversary, and we were planning to have big gathering and all. So, and now I was in a big dilemma, or you can say the pain was increasing, the dates were coming closer, and it was a like very painful situation in general also, and from my body point of view also, because when you wear the pant and all,
Yeah,
that
must be
area
very
was getting
difficult.
affected. Now, then she stepped in. She is actually a big fan of Ayurveda, as we were discussing. Even her mom got cured of cancer. She had cervical cancer, and it got cured through Ayurveda.
Uh-huh.
And then she said that we don't listen to me. Now I'm going to take you to Dr. Chauhan, and let's see what happens, because and I'm very sure it will be done. So we came to you, and sorry, just one small point. And the in the Fortis, the last meeting with the doctor, it was open ended. So it was something like, we don't know the name of this disease, and it will go away,
No,
and
the
you can
doctor
get
was
the
saying we don't know the name.
yeah, the name was not given. It will go away. Why it happens, we don't know. And only thing is that you get the surgery done, and that is the only solution. And something like that. It was very open-ended type. It was not like something that okay, I can say that okay, this is the final thing. Then we came to you, and then for the first time, I think you took only 2 minutes. You saw and you said this is Hidradenitis.
This is the name of the disease.
And I remember very well that I think you gave me 4 medicines. One was curcumin, one was neem, and one more that Google.
Ayurvedic antibiotics.
And one was the one kada, right? Which I have to
So
prepare.
neem, Google, turmeric. It's very simple.
Yeah. So I was, I said that यार इतनी भयंकर प्रॉब्लम है, ये कैसे ये नीम से लाइक हो जाएगा.
आप हिंदी में भी कर सकते हैं.
हाँ, नहीं मतलब
doesn't matter. It's okay. We can put the subtitle.
Yeah. So I was like little apprehensive about it, but she said okay, just blindly believe, and we don't have any option.
नीम, हल्दी और
तुलसी और गुगुल, हाँ, 4 थे.
इससे कैंसर भी ठीक हो जाता है. ये तो बहुत छोटी सी बीमारी है.
और एक काढ़ा था, तो वो काढ़ा मतलब you have to prepare it like put some 1 glass of water, 1 teaspoon, and then make it until half glass of water, boil it, and then drink it.
All right.
And since I didn't have any options, so I went with that, with the belief that okay, I had 50%, to be honest. She had 100% belief, but and after I think just 1 week, to my surprise, I was just every day I was checking. I told her कि लग रहा है ये कम हो रहा है. So I was like very surprised, honestly. And I think after 15 days it was gone. And 15, I think around 2-3 weeks. And you had asked me to come back after 1 month. And when I went back to you, I said, okay, no, it is totally gone. And yeah, the rest is. And then I think I wanted to be 100% sure. So I took 1 more month medicine, though you said that, okay, you can manage within that. But yeah, so this is the overall, like, what it went through, what I went through, and how I got cured for this. And it's really magical. And like surprising, and thanks
Ranjit
to
ji,
you and of
thank you
course
very
my
much.
wife
Just
also.
imagine how in ancient times how the people must be healing the wounds.
Right, right.
In older times, there were people having a lot of wars. Ancient kings and ancient warriors, they were having going through the wars, and they would get, of course, infections in their wounds, and there will be pus formation.
Right, right.
And how they will heal them? So these antibiotics were not there at that time, but the Ayurvedic natural antibiotics were always there.
Herbs and all, yes.
This neem and turmeric and gugul. You heard about this gugul dhoop?
Yes, yes,
When
yes.
we burn the incense made from the gugul dhoop,
Right. My grandmother used to do it.
every day we are also doing it.
Yeah.
It is just killing the bacteria and the
Germs and
germs.
all.
Right,
Yeah.
right,
So
right.
because it has the plant resin called gugul. So many other herbs
Even
also, like sandalwood.
I do.
Sandalwood is there, turmeric is
Right.
there, neem, tulsi, all such herbs are excellent. And we in Hindu religion we do perform yajna.
Right,
So
right.
yajna is also performed, and we put the havan samagri in that. And the havan samagri is made from various herbs, various plants,
Right.
including various resins and all those medicinal plants having antibacterial properties.
Right,
So
right.
to purify the air.
Purify the yeah.
So these are the miraculous herbs. And Hidradenitis Suppurativa, this is a very complicated disease as per modern medical system. People, they suffer from pus pockets under their skin, under the armpits mainly, under the breast, under the buttocks and all, wherever the skin is folding. So patients are struggling, and the doctors are giving a lot of antibiotics, that there is not a response. It
Right,
is
right.
occurring again and again,
Again
and
and
there
again.
is a lot of surgeries are going on,
It was painful as well.
and it's
Terrible
very
pain
painful.
sometimes. Yes.
Surgery is really painful, and I remember 3 months was really hard for me, because every day I had to go for my
Dressing.
dressing and all, and I had all the medicines. I took all the antibiotics which were prescribed, but yeah, it was, to my surprise, it
Temporary it was.
So people don't come to Ayurvedic doctors, and first they go to modern doctors, and they go to big hospitals for such small things. I would say small things. I have made a video of another patient. And in the vlog, you can see in the vlog, we make OPD vlogs also. There was a patient, he was advised to cut off his leg, because he was having pus in the gangrene formation in the leg,
Oh my God.
because of diabetes. It is called diabetic foot. Because of diabetes, prolonged gangrene is there, and there is a lot of pus formation, and there is the wounds, they don't heal, the diabetic ulcers. So there was pus also, and the whole foot and leg was black. And the patient came to me in that situation. He already had his big toe cut off, both the feet. So his feet were these big toes were gone, and the doctors were planning to cut off one of his leg. So at that stage, he came to me, and we gave the same Ayurvedic antibiotics, turmeric,
No,
neem,
really.
gugul, all basic things, and aloe vera juice and tulsi. Within 1 month, his feet was fine.
Oh, wow.
And he is also himself very much surprised how it is possible. तो आप बताइए आपका एक्सपीरियंस इनके साथ कि कैसा, क्योंकि आपको तो आयुर्वेद पे फेथ था, तो जैसे इनको हुआ आपने देखा,
हाँ जी.
तो क्या एक्सपीरियंस, आपको क्या लगता था कि कैसा, आपका तो बहुत सिचुएशन स्ट्रेसफुल हो गई है ना?
राइट. बिकॉज वो एनिवर्सरी भी हमारे पास थी, इट वाज लाइक लॉट ऑफ प्रेशर ऑन अस कि क्या होने वाला है, बट ही वाज इन पेन आल्सो. प्रेस करो तो पेन हो रहा है, रेडनेस हो गई थी. We were like, I was like very hesitant to tell him कि let's go to Ayurveda. He was like, रुक जाओ यार, अभी सर्जरी कराने दो मुझे, देखते हैं उसके बिना नहीं होगा, देखते हैं क्या होगा. बट जब सेकंड टाइम हुआ तो फिर भी मैं शांत रही. मैंने कहा नहीं, अब let him do what he's doing. So at last जब सब कुछ हो गया, और फिर जब टर्म ही नहीं पता लगा कि बोलते क्या है.
हाँ.
Then I asked him to just blindly follow me.
Okay.
Then we came here and you're an angel then.
No, actually,
Yes, you are
she
an-
follows Ayurveda like every day
It's-
morning, like
yeah.
in general practice. Like
Yes,
we have
yes.
methi in the
Methi
morning,
pani and then coriander ka
coriander
pani,
powder, basic stuff
Yes,
that
yes.
is throughout.
ginger
So
honey, subha.
thankfully, we
You should take amla because
Amla
as I
also.
was telling you, amla is like natural collagen formation,
Right,
collagen
right.
booster, helps in collagen formation,
Right.
full of vitamin C, anti-aging,
Anti-aging.
so perfect for all the diseases,
Yeah.
DNA repair.
So thankfully we don't have any like BP or sugar or any kind of those things which means I recently met like we have a college reunion, and also I met many of my friends, and somebody was having BP, somebody was
Mostly
sugar, and everybody. So I told them that okay, why don't you follow Ayurveda, because or in general like do some basic stuff like
Yeah, yeah.
have haldi or like as you said like methi and means other tulsi and all that stuff. So people are not that aware, and they were having medicines like and those medicines are since they are having it since I guess
Many years.
many years.
Yeah, yeah.
I said, yeah,
And they are
ऐसे कैसे
reaching
हो सकता है?
nowhere.
हाँ, and
Nowhere,
reaching nowhere. And that this is a very basic awareness that,
Everybody nowadays, everybody wants quick solution,
but that is
But
not
Ayurveda gave quicker
quick
solution.
solution. Yeah,
yeah, I agree.
Everybody looking for quick solution, and Ayurveda is
Ayurveda
giving
gave a
quicker
quicker
solutions.
solution. So that is
If somebody asks me Ayurveda works or not,
Mhm.
they say it doesn't work, or if it works, it takes a very long time. I tell them just take some black pepper, ginger,
yeah.
and put them in your mouth and then crush it,
Yeah.
and then you will see within seconds you feel hot. So
All
there,
kinds of herbs in your kitchen itself.
Yes,
I mean,
Yeah, your kitchen actually is a very big, there's a medical store out there.
Within
But
no
the only thing
time-
is that you have to
be aware.
be aware and understand what
And
to use.
well educated about this.
actually Ayurveda is our India's traditional Indian medical system, ancient. Ayur and Veda. Ayur means life, Veda means knowledge.
Knowledge.
So knowledge of life, that is Ayurveda. So it explains how you can prevent diseases
Yeah.
rather than finding the diseases.
Right.
In the name of preventive medicine, what is happening? People, the doctors, they are doing the investigations to detect the disease which is already there. But Ayurveda is emphasizing on prevention of disease. Real prevention is
Right.
changing your lifestyle, changing your eating habits, changing your way of thinking, way of doing things, so that you don't fall sick and you actually prevent the disease. So that is how Ayurveda works. And of course, after prevention, if some disease is there, we can definitely treat it from the root.
Right.
So thank you, Ranjit ji. Thanks a lot. Thank you very much.
Thanks, sir.
So
Thanks.
it's our pleasure completely.
Thank you.
Pleasure. Thank you so much.
अब घर बैठे ऑनलाइन कंसल्टेशंस करें टॉप एमडी आयुर्वेदा स्पेशलिस्ट के साथ। इंडिया का बेस्ट ऑनलाइन आयुर्वेदिक क्लिनिक और पाएं सारी आयुर्वेदिक मेडिसिन की होम डिलीवरी वर्ल्ड वाइड। प्रॉब्लम कोई भी हो, सोल्यूशन सिर्फ एक। www.planetayurveda.com। लिवर, किडनी, लंग्स, स्किन, दिल, पेट, घुटने, सिर, पैर या बॉडी के किसी भी पार्ट से जुड़ी हो कोई भी समस्या, अभी कॉल या व्हाट्सएप करें और घर बैठे समाधान पाएं 6209123456 पर। हाँ जी, अब सब बीमारियों का इलाज है बहुत आसान। आपकी सेहत से जुड़ी हर समस्या का समाधान मिल रहा है घर बैठे। अब आप दुनिया के किसी भी कोने से टॉप प्लैनेट आयुर्वेदा एक्सपर्ट से ऑनलाइन बात करें, परामर्श लें और दवा की भी करवाएं होम डिलीवरी। हेल्थ प्रॉब्लम्स कोई भी हो, सोल्यूशन सिर्फ एक। www.planetayurveda.com। पूरे प्लैनेट की सेहत का नंबर 1 साथी।